Co łączy wzrost gospodarczy i konkurencyjność gospodarczą ze zdrowiem? Porozmawiam za chwilę o tym z moją gościnią. Dzień dobry, Zbigniew Bartuś, Dziennik Gazeta Prawna. Jesteśmy w studiu Dziennika Gazety Prawnej i Szkoły Głównej Handlowej w Warszawie na Europejskim Forum Nowych Idei w Sopocie. A moim gościem, czy moją gościnią jest Geraldine Schenk, dyrektor zarządzająca Johnson & Johnson Innovative Medicine Poland. Nice to see you again in our studio. Hello. Dzień dobry. We know that dzień dobry is, yes, you practice. So let's practice the medicine. This is the conference about economic growth, about competitiveness. So what is the link between the economic growth and competitiveness of Europe today? What is the main link?
One important aspect, and maybe I'm a little bit biased here because I'm working in healthcare industry. Yeah. I think one very important aspect is the health of the people working in the economy or working also within the European Union, for example. Because we think that if you have a healthy population, you also have a wealthy economy. Right? Why is that, right? If you have people that can go every day to work, contribute to the to the social environment, right? To the overall success of the economy without staying more days at home sick, or you need even more caregivers to take care of them. I think this is a crucial element. And I think therefore we think investing in healthcare is not a short-term cost point of view. I think it's more an investment into the future.
Yeah, we've got reports that under investment in prevention, for example, and in health care systems may cost Europe more than the entire budget of the European Union.
Yes.
Yes. Yeah. So how could you comment it?
Yeah, and I think this also is a little bit linked to what I have said before, the long-term investment, right?
Long-term investment in what?
In what? In prevention. So for example, every euro or every dollar that we spend currently in prevention is getting back to the society by 17-fold, right? So, which is kind of...
So this is not the cost, this is...
It's truly an investment, right? And I think the more we can go towards prevention of chronic disease, I think that is literally one of the key players or key aspects to be competitive, right? Just building on that. For example, if we can prevent better obesity, diabetes, with all the chronic diseases that is following them, I think we can also then start to have people, as I said, more active into work. We need maybe less days of caregiving, right? People recover faster from treatments. If we go more also towards individualized or personalized medicine, we know what is the right treatment for the right patient at the right time. Yeah. And all this also helps the economy to grow and to thrive, and maybe also address some of the big challenges that we have currently in healthcare.
It's called precision medicine. Yes. Yeah. Should we invest in this area? What is your hope joined with this kind of medicine?
I think absolutely. I think we should go in precision medicine. Because why is that? I mean, we learned throughout the course of our research activities that it's hard that one pill or one treatment fits all the patients or all the individual needs. The more precise we can go via, for example, genomic testing, where we sequence certain DNAs, where we identify some DNA disruptions or some specific needs that a patient needs to have in the treatment, I think we can guarantee the best treatment outcome. Because if the physician can make this informed decision of what is the right treatment from the very beginning of the course of the disease, the outcome is better, and we're also optimizing the costs.
The costs, yes, because I'm asking it about this because all the systems in Europe, not only the Polish systems, the healthcare systems are under financial pressure. So we have aging societies, and the pressure, I think, will be bigger than today.
Yeah.
So we've got growing demand for innovation also. Yes.
Yeah.
Because the problem of Polish and European competitiveness is innovation. Yes. Including innovation into our economy.
Right.
So where is the economy in and the cost? You said something about this, but please say more about this area of this revolution, I think.
Yeah. So I think currently and there is, I think, also a report that says, so currently 1.5% of the entire healthcare budget is related to the innovative drugs or the innovative treatments that have come to the market in the last 5 years. 1.5%. The rest is literally a little bit related to the healthcare systems, how they work today. And I think maybe it could be worthwhile to have a look into the healthcare systems processes. Because if you want to go towards precision medicine, if we want to go towards the advanced diagnostics, I think we need to do 4 things. So firstly, we need to create the awareness, right? That there are these tools related to the prevention, related to the diagnostics at the patient, but also at the healthcare professionals level.
Because good diagnostics is the key to the precise
Exactly.
medicine, yes?
The good diagnostics and the diagnostics early on. Right. So I think the second element that we need to consider is the availability. So is this already existing? I think here we see also a kind of a big element that we need still to train a lot, right? Because it's currently not fitting into the day-to-day processes. If we say, look, we want to do an additional step, it's always a very big disruption in the day-to-day processes and procedures of a hospital. So I think this is also something what we need to look into. And I think then, yes, of course, we need to have then also the knowledge and the notion how to do it. We had previously a conversation about, is Poland ready for next-gen sequencing? So really doing the gen sequencing for every patient, that we know what would be the best treatment for this patient, or will this patient respond on the treatment at all? And I think lastly, we need to have the debate around how can we come with innovative ideas to create the access, right? The access in the hospitals, but also a low entry access for the patients, right? So, and I think these are, from my point of view, the 4 important elements that we need to address. It's a lot, but I think we should start for the sake of the patients.
Do you believe that we do enough to make Europe the healthiest continent in the world?
Well, I think there are good trends. Are we there yet? I don't think so. And it's fully obvious, right? And fully understandable that also there are different priorities currently. I mean, when we look at the situations that we are facing now, wars in Europe, wars close to the border of Europe. Of course, there is an absolute legitimate debate on where to spend the money.
Let's buy armor.
That's
exactly
one of the right. Either you defend in the defense system, or should we go more towards healthcare? But I think on a long run, right, healthcare should be on the top. Right? Because I think this is literally something what brings Europe ahead, and also I would not say, well, ahead of other continents. I cannot speak to that, but I think really can make Europe more competitive, right? Because as we said, the level of health of the population is directly linked with the wealth of the economy. And I think, yes, of course, we can do more. I think we can, for example, leverage the fantastic data that we have all around Europe. There is now the project ongoing with the European Health Data Space, where there are the discussions, how can we give access to this amazing healthcare data to the governments to make the right decisions, to the researchers, to accelerate the research, to even accelerate the innovation, and therefore the access for the patients. So I think there are a lot of good initiatives currently going on, but we need to continue these good initiatives.
We don't talk about the perspective of patients, not only patients, not only business perspective.
Yeah.
This is the joint perspective of common perspective of all the economy, also the defense business. Yes?
Exactly right.
Yes.
Yeah.
This is have you met any policymakers here?
Yes, I have. I had the privilege.
What is the reaction to this kind of talking about the health system?
I think you could see a little bit the dilemma in which they are currently, right? Because I think firstly, it's when we say, look, we want to become one of the healthiest nations or one of the healthiest continents, it's all about education. Education. I think we have so many good programs also currently running in Poland where we give very easy access to patients for preventional screenings, right? Like skin screening, prostate cancer, breast cancer, you name it. Everything sometimes at a very low cost or even for free. But do our patients really know that? Are they aware of all these great opportunities and offers and services?
They are not aware, or they don't want to go.
Of course, because there is also...
I will do it tomorrow, after tomorrow, or
and
so
this
on.
Is absolutely understandable, because there is always the risk if you go to this kind of screenings that something will be detected, right? So it's also a little bit of a fear included in that. So I think it's all about the education on the first hand, but I think also on the second hand that we need to make our systems ready for the innovation that is coming in, because sometimes the innovations are there, but the systems or the processes are still lagging behind. And then we see also, as a human being, right, the frustration if it's not working out, if I need to go the extra mile, and then all of a sudden the willingness to go there is then also a little bit lower.
So we need the awareness of policymakers and common people.
Of the common people and, of course, of the healthcare workers. They do this fantastic work every day.
Yes. Thank you very much.
Thank you
for this interview. Geraldine Schenk, dyrektor zarządzająca Johnson & Johnson Innovative Medicine Poland, była moją rozmówczynią. Thanks a lot.
Thank you.